So I think we can get starting now. So once again, I welcome everyone, both virtual and in person, at the WHO Health Pavilion in Glasgow. And I would like also, of course, thank WHO and COP26 organizers for the opportunity to have this side event at the COP26 Health Pavilion in Glasgow. So this topic and session, which is entitled Untapped Potential of National Public Health Institutes as Key Climate Actors, has the following objectives. It is to show the existing and potential key role of NPHIs in climate adaptation and mitigation. And the main purpose is to launch the IANPHI Roadmap for action on health and climate change that will be presented to you later on this session. And this session was co-organized by IANPHI, the National Public Health, the National Association, International Association for Public Health Institute, Santé Publique France, and Health Security Agency. So some few housekeeping information because before we go to the introduction of the webinar, so please feel free to comment in the chat and ask questions in the question and answer box all throughout the session. And so I would like kindly remind you that the meeting is being recorded and the recording and slides will be made available on the IANPHI website and emailed to participants. So just to introduce the session, I would like to give the floor first to Professor Duncan Selby, who is president of the IANPHI Association, and to Professor Geneviève Chen, Chief Executive of Santé Publique France, that will give us a few words of introduction. So Professor Selby, please. Thank you.
Thank you, Sebastian, and hello everyone. And it's hugely it was a delight to be here and to have this opportunity today, which we're doing in conjunction with Santé Publique France and with the UK Health Security Agency, but under the banner of IANPHI, which Sebastian has introduced, the International Association of National Public Health Institutes. And this is 95 countries in membership, 110 institutions. And we're all part of government in our countries, and we all have responsibilities for protecting and improving the health of the people. And there's no higher concern than climate change. And this session is about showcasing the practical ways, the concrete ways in which national public health institutes are already involved in adaptation and mitigation for climate change, but also there's so much more we can do. Early in 2021, 15 of our institutes in every corner of the world got together to look at what we're doing now in climate change and responding to climate change around the world, and to prepare what we've called a roadmap about how we can go further and do more. And we're hoping to inspire more involvement of national public health institutes in this work through this roadmap, because we believe that national public health institutes can be key actors in climate change, and we very much want to play our part. I'm going to hand over to Geneviève, who will speak about some of the examples, and then we'll get on to the programme as a whole. Geneviève, over to you.
Thank you very much, Duncan. Ladies and gentlemen, and dear colleagues, I'm also really delighted to meet you, even through this video. In this session. So many of you have joined from very far reaches of the globe, where you are the lights of your nation for public health. We all share the growing recognition that climate change, loss of biodiversity, and the destruction of nature are major threats to global public health. The far-reaching consequences of the COVID-19 pandemic also support the needs of a stronger integrated vision of climate, biodiversity, and health. As Duncan mentioned, secure and healthier environments are the greatest challenge of the 21st century. And I would like, with all humility, to share with you how Santé Publique France is thinking about it as a very active member of IANPHI. The founding event of this awareness for Santé Publique France is the experiences of a very strong heat wave and goes back to 2003 in France. The excess mortality was nearly 15,000 people during the first 3 weeks of August that year. Since then, we implemented a sophisticated surveillance system together with the National Weather Forecast Agency, Météo France. Now, surveillance is also integrated with prevention by informing everyone at the right time about the best behaviors and also by bringing concrete solutions to reduce exposure to extreme heat. Yet the number of heat waves has increased in France, and although no one is comparable to 2003, the human toll remains too large. There are also many lifestyles that are known to be unhealthy, such as sedentarity or unhealthy food diets leading to air pollution or lack of access to nature. It is our responsibility as national public health institutes to mobilize essential public health functions to act for healthier environments to mitigate or reduce the impact of climate change. For example, for extreme weather events or air pollution, we need to monitor them to measure the impact on health and promote more healthy environments. Like other institutes, at Santé Publique France, we base the implementation of essential public health functions on the best available scientific data. For example, for the modeling and anticipation of the dynamic of epidemics of vector-borne disease at a regional level. For example, for the economic valuation of the impacts of air pollution on health. Therefore, we need all sciences to be strongly supported and attractive to the best researchers willing to make a difference on the value chain up to innovation for a healthy environment. We not only need to measure the problems, but also promote and implement concrete solutions known as efficacious. Like other institutes, at Santé Publique France, we also base our actions on a constant dialogue with representatives from all sectors, as well as local and national decision makers. For example, by developing tools to quantify the health benefits of climate policies in the field of air pollution and urban planning. Therefore, we collectively must go beyond think globally, act locally. We need to think and act at the best possible level to be efficient, because everyone can contribute at her or his level to collectively think and act. Today, from the Health Pavilion of WHO and through IANPHI and with our UK colleagues, national public health institutes worldwide are now uniting forces to strengthen public health in climate change, mitigation, and adaptation. The IANPHI Working Group is a first step of international collaboration that builds up on already existing actions at the national level. It is the start of a momentum where national public health institutes are actively showing that they are doing their share, they are sharing experience and good practice and keeping track of progress on public health using a common dashboard. At Santé Publique France, we are committed to strengthen all these common activities, and we need you all to achieve this collectively. On the 8th of April 2022, we will organize in collaboration with IANPHI the next event on climate change and public health. I invite you to join us and discuss together the first achievements and the ways forward. But for the moment, we are not being surprised nor discouraged by the resistance of the spirits we are facing or going to face. We need to accept it and collectively move forward, since we cannot turn heads or close eyes if we want to contribute to open the door of a better future. Can we achieve that goal? I share with you my thoughts. We cannot avoid it. It can only be delayed or hastened, that's all. So as national public health institutes, let's think and act at all possible relevant levels to accelerate the way to our common interest and our common destiny with the planet. Thank you very much and enjoy the roundtable.
Thank you very much, Duncan and Geneviève, for these very good introduction words and very enthusiastic and devoted to actions. So, and now I would like to give the floor to Dr. Revati Folky. I think we have the link with the WHO Health Pavilion. I'm not sure, but
Yes,
we just try, Revati. Yeah,
yes.
Hello, how are you?
Hi.
And so, Revati, you are Head of Climate Change Analysis Unit at UKHSA, and so you will provide us with the presentation of the roadmap, and you have 8 to 10 minutes to do this presentation. Thank you in advance.
Yeah, thank you very much. And thank you for, thank you IANPHI for including UKHSA into these conversations and also giving us the opportunity to contribute to the roadmap, which is really, as the previous speaker said, it is a joint vision that we would like to implement going forward together with other national public health institutions. And I think that we've heard enough in the last week or days. We've heard a lot about climate change being being also a health emergency, and all that it's the greatest threat. We've read this 100 times. I would like to turn the argument into saying that this is also our greatest opportunity. And we have seen that, of course, there is recognition that this is a challenge, but most of the momentum is to move to what can we do about it. And I think one of the things that comes out of this COP is, of course, to keep the 1.5-degree ambition alive. And there is every interest of the national public health institutions to rally behind this ambition so that we can then be better equipped and for protecting the health, and which is our main mandate, protecting the health of population. So every half degree is a concern for public health people. And I think that as we emerge from the COVID-19 pandemic, things are clear. We have spoken a lot about health systems resilience. We have spoken about community resilience and everything. But this is the opportunity, because most of the conversations that are being worked about resetting business as usual, this is our opportunity to do it. This is our opportunity to take a step back and really implement health in all policies, in all climate policies, and climate in all health policies. This is nothing new. We have heard and spoken about it for decades, but this is our opportunity to reset and find those leverage points in policy and practice where we can join the siloed working of the climate community and the health community. So I do see the emerging challenges from plans that are being rewritten to some extent after the COVID-19 pandemic. And of course, we also, I think the health community appreciates a lot the multiple benefits that we can have from climate action. And this is really the main argument for why every climate action is a health intervention. So everything that we do for climate change will be beneficial. And of course, we have to think carefully about the disbenefits and all of those things. But the larger picture is that everything that we do for climate change should be good for health, and the other way around. And next slide, please. And I think we have appreciated what the role of national public health institutions can be. But the main thing that I would like to say is that we are in a unique position where we are generating evidence, we are processing evidence, collating it, and we are making it available not only to the policymakers, but also to the communities. Through the advice that we are generating for health protection. So we are in that unique position that we, in this entire knowledge ecosystem, we have the ability to mobilize knowledge in both directions, in the direction of the people, where action at scale can be taken, and in the direction of policy, where all the main leverage points are for scaling up action, and which is exactly what we've been talking about for the last whole week. So of course, the three key functions that, as you see on the screen, is, of course, the first one is that national public health institutions are responsible for monitoring the health impacts of climate change, but also monitoring the acceleration of them. And not just what the impacts are felt at the population level, but also where are we with responses. I think that is the key conversation that we need to have, that yes, we have to large extent, we know what the health impacts are. We may not know all the details, but we know enough. And we know enough of what can be done about it, that you can start monitoring and accelerate that monitoring as well, and strengthen national public health institutions to be able to do that in a comprehensive way. Of course, Apart from understanding the impacts, national public health institutions are also frontline responders. Many of the national public health institutions are responding to the extreme weather events of climate change, nutritional impacts, and all the other health impacts that we see from climate change. So whatever evidence that we are processing and generating, we are also using ourselves to design and implement interventions for climate change and health. And of course, that also applies to the advocacy component of it and behavior change component of it, where health protection advice is essentially guided by the evidence that is available to national public health institutions, and how can we operationalize the changes that we do. So in that sense, we are sitting in between the clinical and the curative health systems component and the community health systems. So together, these three systems are essentially looking at health protection improvement and the well-being of the populations that we live with. Now, some of the work that the climate change group within the IANPHI has done, a survey that we recently implemented, we found out that the full potential of the national public health institutions is not yet reached. So yes, there's a lot of effort ongoing, but we should be reaching full potential to be able to make that difference. We realized from the survey that few of us are identifying ourselves as key climate actors. We do still externalize the climate action, and I think we need to internalize that. There is involvement of national public health institutions in the NAPs and the adaptation communications, but that can also be improved. It's still not, again, as I said, reached potential. And of course, resources as well. So there are inadequate resources within national public health institutions to be able to deliver the level and the scale of interventions, but also the improvement in our understanding of the impacts, and that needs to change. So in some sense, this is a lost opportunity that we would like to kind of course correct as we go ahead into the decade for action until 2030. Next slide, please. So the roadmap of the IANPHI basically identifies 5 priority areas for action, which will guide the work of the working group going forward, and hopefully inspire national public health institutions to collectively implement and scale up these actions. The first is, of course, to advocate for effective climate research, policy, and action. And this applies, of course, to mitigation and adaptation both. And by advocacy, I also mean for raising our voice, joining the voice of the other health professionals in demanding climate action for health. The second is, of course, to enhance the capacity and the competence of colleagues in national public health institutions and facilitate peer-to-peer exchange, knowledge mobilization, not just from organization to organization, but from communities to communities. And this will be achieved hopefully by sharing of case studies, supporting each other with the methods that are there. Quite many national public health institutions are quite advanced with their risk assessments or scaling up adaptation. So learning from each other really, and making that information available to national public health institutions globally. Complementary collaborative action, not just at the global level, but also at the regional and the local levels, and working just not within the health sector, but also the health determining sectors, because again, we are in that unique position to bring everybody around the table to scale up action on climate change. Number 4 is, of course, lead by example. So we've heard a lot about mitigation in the curative side of the health systems, but I think that conversation needs to be had also in the public health service delivery component of the health system. So lead by example by doing our own carbon footprints, but also advocating for scaling up adaptation action alongside maintenance of mitigation action within the public health service delivery. And then the 5th and the last one is, of course, to monitor progress. So what progress do national public health institutions to make from now, say in the next 5 years, on their role as advocates for climate action, or also their involvement in the national adaptation programs or the health NAPs and so on and so forth. So making sure that we document and share with each other examples of what action has been taken. Next slide, please. Yeah, so I'm very pleased to say that the roadmap and the position paper is available in 5 languages. So please spread the word and share it as widely as possible. Next slide, please. And that's the link, and we are also, of course, it's available to you on the social media to share. Please spread the word. We would really appreciate as widely as this can be sent out too. And then, of course, none of this would have been achieved without our colleagues, the members of this Health and Climate Working Group, names of whom you see on the screen. I would like to thank each one of them, because without that, the roadmap would not have seen the light of the day. And thank you, IANPHI, for stepping forward and getting this done. Thank you.
Thank you very much, Revati, for this very nice overview of the roadmap that was linked into the discussion box of the Zoom tool, so everybody can access to it. And as Revati said, do not hesitate to share this roadmap, because it's really important that the information is well known by everybody, and that you can share that in your networks. So now, we have some questions, but what I propose is that we keep questions for the end of the session, so that we can give the floor to three panelists that we invited to this session. And I would like to introduce you to Dr. Juan Rivera, who is Director General of the National Public Health Institute in Mexico. Then Dr. Alonen, who is Research Program Director from the Finnish Institutes for Health and Welfare, and Dr. Ochu, who is Director of Prevention Programs and Knowledge Management from Nigeria. So please, if you could switch on your camera, and then I would ask you for two questions. So the first question, so we'll start with Dr. Rivera, if you agree. What are for you the main challenges faced by your institute in responding and preventing the health impacts of climate change? And you have 3 minutes to answer.
Thank you very much, Sebastian. I'm very pleased to be part of this panel. The National Public Health Institute in Mexico is committed to be an important climate actor in Mexico, Latin America, and globally. And one of the key challenges, and that was the question, challenges in responding and preventing the health impacts of the degradation of our planetary systems, including climate change, is that the interlinks between public health and the degradation of the natural planetary systems that are leading to climate change and biodiversity and other consequences are not always understood among public health professionals and relevant stakeholders. I have recently announced to our community that we are launching next week a planetary health program at the Institute. And the first step in the creation of a program is making sure that all the members of our community, investigators, students, and staff, and our key partners are aware of those interlinks between climate change and health. Our planetary health program will address the health of human beings and the state of the natural systems on which they depend. We will focus on how to understand the relationships between global environmental challenges and human health and well-being, and it will work on research to generate evidence-based policies to promote health, well-being, and development while preserving the environment. The program will bring together investigators from 3 main centers: environmental health, dietary and nutrition, infectious diseases, to strengthen existing research and advocacy projects, as well as creating new ones on the following topics: local and global effects of air pollution, healthy and sustainable food systems, impacts of climate change on infectious diseases, on social vulnerability, on food production, and on catastrophic events, hurricanes, floodings, fires, and monitoring trends in these topics. In addition, the program will incorporate the Mexican School of Public Health, which is part of our institute, with the aim of modifying our graduate training programs in public health and epidemiology to incorporate topics related to the interlinks between health equity and the degradation of natural systems in all our programs. Moreover, for many years, we have had a green program to reduce the Institute carbon footprint. And this program that is called ECO-INSP will be reinvigorated and will be part of the planetary health program. Our institute, the second challenge and I think that I will stop there because it's 3 minutes.
Thank you very much, Dr. Rivera. So, and we've seen the very good, ambitious challenges of Mexico. And the same question to Dr. Alonen from Finnish Institute for Health and Welfare.
Yes,
in 3 minutes
thank
as
you.
well. I know it's very challenging, but
I can be short. Greetings from Helsinki, and thank you for inviting me to this event. It's a pleasure to be here. It's raining here in Helsinki now, not snowing as we would hope to, and that's a sign of the climate change as well. I think here in Finland, the health and well-being effects of climate change have been quite modest so far, and that is one of the main challenges, motivating people to these changes, motivating institutions to start acting, because if these effects are not directly impacting yourself, or they are not very concrete to you in practice, then it might be still difficult to believe that they can be very severe. So I would say that in our context, we still need more of these examples, like last summer's a month-long heat wave period here in Finland, when people actually saw how the climate change is affecting health. And motivating people and still spreading the word about these health effects is our main challenge. Thank you.
thank you very much, Dr. Alonen, for this very concise answer to this very ambitious question. And now I'll give the floor to Dr. Oshu for the same question with the same time, 3 minutes.
Thank you very much, Sebastian, and hi, everyone. It's my pleasure to be part of this panel. Nigeria Center for Disease Control is Nigeria's National Public Health Institute with the mandate to lead in the detection, prevention, and control of infectious disease outbreak of public health importance. The key challenge we have had as an organization has been our exclusion, so to say, in policy making around climate change. So the poor and very weak information sharing systems across sectors, not being able to link climate data with epidemiological data. And this is what we are working towards achieving currently as the NPHI. Secondly, there's been this poor stakeholder engagement and multi-sectoral collaboration in the development of climate adaptation and mitigation policies and guidelines. So this is one key gap that we have had as an NPHI. We've also had inadequate political awareness and commitment, and I believe COP26 has done a lot in improving that awareness and bringing out commitment across different governments and different countries, Nigeria inclusive. We've also had generally low awareness and sensitization on the health impact of climate change, with poor human and technological capacity for real-time assessment and monitoring of carbon footprint. In the Institute, we have moved gradually from paper-based operations to digitization, as well as shifting from the use of fossil fuel-driven generators to now begin to use solar energy in doing most of the work we do, especially in our laboratories. So, but being able to measure the carbon footprint, we do not yet have that capacity, and hopefully with the peer-to-peer sharing and exchange that we are proposing in this IANPHI roadmap, we hope to be able to build that capacity. Inadequate funding is another key challenge. Funding on climate change mitigation activities for the NPHI. Of course, poor funding for research on the public health impact of climate change is another challenge that we face as a National Public Health Institute. Thank you.
Thank you very much, Dr. Ochoa. And so I would like to spend now some time on the second questions, because as Geneviève, Duncan, and Revati said, the time is for action from this ambitious observations. So what would be one example of key climate action led by your institute? So, and I propose that we start again by Dr. Rivera from Mexico.
Thank you.
In 3 minutes as well.
Thank you very much, Sebastian. So one of the actions that we are leading in Mexico, our institute, is the transformation of our food system. As we know, the food system globally is responsible of a great deal of the greenhouse gas emissions and global warming and other aspects of natural earth system degradation. And in Mexico, we have exactly the same situation. And I was part of the Eat Lancet Commission, and we developed there, we proposed a dietary, a healthy and sustainable diet that has to be adapted to the local conditions of each country, with the idea of having a demand for a type of diet that will not impose that burden to the environment. So at the Institute, we have been working on the development of local estimates of the environmental impact of the production of different foods in Mexico. We have created the Mexican Healthy Diet, which considers our food culture and the environmental impact of the food groups. And we have compared the cost of the current diet consumed by Mexicans with the new healthy Mexican diet. And we have concluded that in the case of Mexico, the healthy diet is 22% less expensive than the current diet. This means that the cost in Mexico will not be a barrier for adopting the healthy diet. Moreover, our traditional diet complies very much with the recommended healthy diet. Our institute is also leading the development of the new Mexican dietary guidelines, which will consider not only health, which is being considered up to date, but we are also including the sustainability of the environment so that we can contribute to avoiding or to reducing the degradation of our planet, including climate change. The guidelines will be published next year and have the approval of the Ministry of Health, the Ministry of Agriculture, and the Ministry of Education. That's one example of an action in Mexico. Thank you.
Thank you very much, Dr. Rivera, because I think that this example is very appropriate in the frame of the climate change mitigation and adaptation issues. And now I would like to ask the same question to Dr. Alonen about one example of action.
Yes, at Finnish Institute for Health and Welfare, there has been research on the health and well-being effects of climate change ongoing for some time. And partly based on that evidence, last year we prepared and were in a major part of preparing climate change adaptation plan for Ministry of Social Affairs and Health in Finland for years 2021 to 2031. There were several experts from our institute contributing to this plan, and together with also experts from Finnish Occupational Institute, we were able to include several aspects of health and well-being into this plan. As examples, the health and social welfare section includes non-communicable diseases, communicable diseases, nutrition and health, occupational health and well-being, as well as social impacts. Then there is also a section about the services that include healthcare, social welfare, and occupational healthcare. We also touch upon security of supply, cross-sectoral impacts, and knock-on effects. And the plan includes over 40 objectives on the mentioned themes and over 90 recommendations for action. And the plan can be used by different organizations, but also by the public and researchers we also recognized some gaps in evidence where more research is needed. After launching this plan, we have presented it in several events, and another event that is coming is for practical nurses and nurses who are still studying, and we are going to have an event together organized with the Finnish Science Center, Heureka. So we are trying to implement this plan widely now. And so far the plan has been warmly welcomed by the end users. They have been waiting for it. And I'm happy to tell you that the English translation of this plan will be available rather soon, I hope during this month. Thank you.
Thank you very much, Dr. Aronan, for also these very important examples that you've taken about, for instance, education of nurses. And I think it's also a very important way to act. And so now, Dr. Ochu, about the same question about one example of key climate action led by your institute in 3 minutes, please. Thank you.
So the Nigeria Center for Disease Control leads in disease surveillance, and we are working closely with the Nigeria Meteorological Agency to link data from climate change with disease outbreak. We have an integrated disease surveillance and response system, and currently we are using digitized surveillance tool for real-time disease surveillance and reporting. So our ability to link climate change data with epidemiological data of these diseases will go a long way to help us in our risk communication and community engagement activities, as well as in our advocacy for strong political action against climate change. We have a robust multi-stakeholder, multi-sectoral engagement platforms through the incident management system that allows us to engage critical stakeholders that will be very, very relevant in driving communication around climate change action. So we use these robust platforms that bring together ministries, departments, agencies, and civil society groups, and even the non-governmental organizations, as well as the academia and our development partners and the private sector in our preparedness and response activities against infectious diseases of public health importance. We believe that being able to merge these data on climate change with the epidemiological data currently, that this will be a very strong advocacy tool. We've had spikes in Lassa fever outbreak that are linked with practices, farming practices of bush burning that are deleterious to the climate. We've also had outbreak of cholera linked to flooding, but we are working now closely with NIMED to be able to generate data that will be an evidence of how these things link together. So this is one of the key actions that we're taking as a National Public Health Institute. Thank you.
Thank you very much, Dr. Ochu, for this very clear example of key action in Nigeria. And and thank you to all three of you for very concise answers, and we are perfect on time. So now we'll have time for question and answers. So you have a box, a dedicated box in the Zoom tool for those people who are attending by video conference, but I think that we have one colleague with Dr. Liu from CDC China who would like to take the floor and to make some comments about the roadmap and the different answers that were issued to the two questions. So Dr. Liu, I can see your name. So please, you can switch on your camera and you can have 2 or 3 minutes.
Okay, thank you. I'm sorry for the camera problem.
No problem.
It doesn't work. Okay, so I think this is a very good roadmap for the public health institutes to adapt to the climate change and to mitigate climate change. And I would like to share my experience in China, CDC. And we are now trying to establish a strategic plan for the health adaptation by 2035. It will be available soon, maybe at the end of this year. And we try to establish the long-term plan for the health adaptation with the stress on the public health surveillance, planning, and monitoring and action. And with this plan, we try to make the risk assessment caused by the climate change in China. And I would like to know if there's any other national public health institutes, they have the similar plan for the long-term adaptation or mitigation for health. Thank you.
Thank you very much, Dr. Liu, to give this example that gives us the opportunity to know what China plans to do in terms of climate change actions. And I think that around this table, we have a very good representativeness of different countries all over the world. So that's also very important to see that each national public health institute that are engaged into this action and into the good way and to follow the roadmap. So now maybe we can take some questions from on-site attendees at the WHO Pavilion, and I would also invite you to ask questions for people who are attending remotely on the question and answer box. And if questions are targeted to a specific speaker or panelist, then this speaker or panelist can answer directly in the question and answer box as well. So is there anybody on site who would like to ask a question? And in this case, I would suggest that Revati, if you agree, you could maybe
yeah, I'll hand over the microphone if
okay.
there are
Thank you very much.
Any questions from the room. Any comments? Okay, so nothing in the room. Over
okay,
to you.
Okay, thank you, Revati. So maybe we can take a first question for you, Revati, which was written in the question and answer box. What are the biggest evidence gaps in the association between climate change and health? So I don't know if it's easy, but
well, I think there's no simple answer to that. But I think that in a couple of sessions in this pavilion, we have discussed that some topics are better addressed than the others. And of course, the clear ones that probably have been neglected is mental health. We still don't understand enough of how mental health is affected. And then the additional layer of climate anxiety. So I think these are the two things that come to my mind. And then, of course, there are a lot of gaps in our understanding of adaptation action. So there are regional variations, subnational variations in how well adaptation action has been documented, and evaluated case studies of evaluation of adaptation action, I think, are still missing from high impact areas. Health systems, again, not because it's close to my heart, but I don't think that we completely understand the impacts of climate change on health systems across the world. And then the issues about resilience within them. So we do talk about health systems resilience quite a lot, but I don't think we completely understand how operationalization of resilience can be achieved at scale. And then, of course, the usual suspects. We know. I wouldn't say enough, but we know a lot. I mean, I have to be very careful in how I say this, but we know about mitigation, but we don't know enough about how mitigation and adaptation can be joined up. And then the last point would be also, I can go on and on about this, but I think the last one will also be that it's the same communities which are vulnerable to multiple impacts of climate change. And I don't think that we have yet understood completely the overlapping and cascading risks that climate change can trigger in high vulnerable communities. And I'll stop there, and I'm sure there will be other thoughts from other colleagues.
Yeah, thank you very much, Revati. Is there any questions from on site now, or should we take another question?
Yes, there's one question on site.
Okay, please go ahead.
Hi, thank you very much. I had a question about.
Please, could you present yourself, maybe?
Sorry, yeah, Pauline Chilwick from the London School of Hygiene and Tropical Medicine. I had a question. The examples that were given by the various speakers were very interesting and showed how they work together with like other sectors in other than health. But we know that there are also quite a lot of areas where we're not entirely sure where there are the co-harms or there are externalities. And would it also be within the remit of national public health institutions to kind of seek more often these cross-departmental or cross-institutional discussions to find these and to kind of prevent that co-harms for health are happening across all kinds of different sectors, including, of course, the climate change examples that we've heard about already.
Yeah, thank you very, very much for this very important issue. I don't know if one of our panelists would like to answer to this remark. Dr. Alonen, please go ahead.
Thank you. Yes, I think this is a very important issue, and we should be advocates also on this, combining the different sectors to collaborate, and also indicating the health benefits for the other sectors, I think is one of the issues that might get them working towards the common goals. And identifying the co-benefits and the co-harms, I think that is part of our job as well.
Yeah, and I think this is very crucial also in terms of mitigation issues. Maybe Dr. DeMarco or Chu, you want to add something about this issue?
Yes.
Yes.
I think that the question just posed, the last question, is very important because, for example, in our institute, we bring together a multidisciplinary group of scholars from different disciplines and backgrounds, because we really need a multidisciplinary and systemic approach for this topic. However, there are many other disciplines that are lacking it in our institute. And I think that we now have realized that we should take advantage of the many networks with several institutions in Mexico, Latin America, and globally. And I would like to strengthen that we should take advantage of IANPHI's new initiative aimed at strengthening this, the National Public Health Institutes as climate actors, because there is a lot of diversity also and richness among the IANPHI institutions. So I think that is something very, very important that we should take advantage of.
Thank you, Dr. Rivera. And Dr. Ochu, on this point, maybe very quickly, please.
Yes, thank you very much. I think the importance of multi-stakeholder engagement in communicating risk on climate change and its impact on health cannot be overemphasized. And one key stakeholder that is usually omitted and which we have discovered is key to communicating health issues is community sensitizers, community-based organizations, as well as community gatekeepers, because the ability to engage the community in our health interventions is very, very key. We need these people that have ability to reach the communities and drive home the importance of behavioral change in mitigating against the effect of climate change on health. We need to engage them, and having that kind of stakeholder engagement platform, like working in technical working groups, or working in using the incident management structure that brings together multiple stakeholders, is very, very important in engagement of all the relevant sectors in communicating the health impact of climate change. So I think it is very, very important that as National Public Health Institute, we improve on these platforms and bring in all the relevant stakeholders to be able to drive home the importance of climate action. Thank you.
Thank you. And indeed, in the roadmap, it is really focused on this point as well, as we are totally legitimate to interact with the different stakeholders. And so thank you very much.
Sebastian, there's
yes,
one
sorry.
question in the room. There's
one question for
yeah.
you also, Ravati. So, but take the question there. Yes. Hi.
Hi, I'm Marka-Lee Alexander from the Journal of Climate Change and Health. And one question I have is, while multidisciplinary communication is so important, my question is, what is the best thing we can do to get health professionals to all communicate with each other? Because I still feel like many people are doing many things in different places, but we don't really know what we're all doing.
Thank you very much for your question. Who wants to take it? Is there a volunteer?
Sebastian, maybe I can make a start, and if colleagues can add to it. I think I can't agree more that we've said this even in the last week in the narrative, that the narrative is that doctors and nurses, health professionals, need to come for join hands for climate change and mitigation and adaptation. I would go a step further and say that public health people have been doing it for some time now. And I think that joining up of those voices, and I completely agree with you that it hasn't happened. At the national level, I can say that, one role that national public health institutions can probably play is to reach out to the how do you call it, the Royal Colleges, for example, in the UK, the Academies of Sciences, for example, to reach out to them and kind of try to find a collaborative way to do it. And the other thing is also that a lot of agencies are now signing up the GCHA pledge for Voice for Health Professionals, and I think that will also bring together these voices in some extent. But it's beginning. I think we are at the start of getting that voice raised and heard, and then we are kind of not there yet in joining it up, and more needs to be done. I agree with you. Thank you.
Yeah, thank you very much, Ravati. And I think we have a quite similar questions about the consideration of public health in the political debate on mitigation and adaptation. So, and as I know that you participate to a lot of sessions during the COP26, I would like to address you this question. What is your opinion on how the health issue is addressed in this COP26, and if there will be something relevant in the final statement about public health and this political debate on mitigation and attenuation? Could you say something about that, Ravati, according to your experience from this COP26?
Again, I can try. I think that it's positive, I would say, that yes, this is the first time that health has received the attention that it should have received for the last 25 COPs. So I would say that, yes, it's positive. I would not say we are there yet, because we are talking about putting health front and central in all climate mitigation and adaptation action. It's happening, but it's happening not fast enough. And I think one key message that comes out for me going out of this COP is that the recognition that health needs to be at the table when the negotiations are happening. And we can only say that, from here on, we make a bigger effort to get to the center and make sure that health is part of the conversations that we go ahead. But yeah, positive, I would say, from my perspective, but not enough as well in the same breath.
So, but thank you very much for this mid-optimistic message, but that's a good way that I think we need to see the things. So thank you very much, Ravati. Is there another question in the room, Ravati? I
don't see, no.
Okay, so maybe a question, once again, a question from the chat box. On the implementing interventions from the scientific perspective often assumes benefits to marginalized and indigenous communities. How involved and co-produced are these interventions, and who is taking them up? Are we increasing inequalities? So I think this is also an important issue about social inequalities that was maybe mentioned by Dr. Chu, or I don't know if you want to.
Yes, I think getting the voices of these people that are marginalized, so to say, heard, and getting them involved in policy and decision-making processes will help in mitigating and narrowing the gaps that are already existing. The problems we've had is excluding them in decision-making. And this is also where civil society comes in to play a very significant role in bridging that gap between policymakers and the beneficiaries of our health interventions. So that inclusiveness is one of the key things that we have seen that drives a lot of the inequalities we see even in health in our communities. So getting these people involved and having a platform and a system that regularly engages all the sectors, including especially those at the community level, is key to addressing some of these inequalities. And this is what we must all do very deliberately in setting up groups and systems that work.
Thank you very much, Dr. Chu, for these last words, because I'm afraid we already have to stop the session because it's 5:29, or in France, sorry, 4:29. Yes.
Sorry, I would like to make one statement. I forgot to mention an important thing.
Sure. You have 10 seconds, Revati.
10 seconds. I would say that yesterday, a very good announcement came out, which I don't know how I forgot, that 50 countries have now signed up for the 52, yeah, 52 countries. That's correct, because yesterday evening 2 more countries signed up for the COP26 health program, which includes commitments on climate resilient and sustainable health systems. So I think that is a big win for the health community, and that also says, you know, there's a lot more to do, but this is a start. So yeah, thank you.
Yes, thank you. It was indeed very important that you mentioned that, Revati. Duncan, you would like to say some final words to conclude?
Oh, just what an important
in 3 seconds.
Yes, such an important moment, and fabulous to have everybody on the call. It is a genuine global concern. We have to work together in the ways that have been described this evening.
Yeah. Thank you very much.
And thank you, Sebastian, for your moderation.
And thank you for all the participants. And I think that now we are collectively embarked due to this roadmap, and we have also the responsibility to declinate it at the national level. So hopefully we will manage to do some nice things and to push public health in this subject of climate change. Thank you very much to all of you, and I wish you a good night. Bye-bye.
Thank you.